Hi, my name is Rakin and today we'll be talking about tuberculosis for this month's health talk. So for today we'll be looking through a few agendas. Firstly is the definition overview of tuberculosis, the prevalence of tuberculosis in Malaysia, the causes and transmission of tuberculosis, what are the stages, signs and symptoms, and the general treatment approach. Okay, let's start out with definition. So what is tuberculosis? So tuberculosis, or TB for short, is primarily a lung disease that can also affect other organs in the body. And regarding transmission mode, the disease spreads through the air when an infected person coughs or sneezes, posing a public health risk. So tuberculosis remains a significant public health concern worldwide, requiring ongoing awareness and prevention efforts. Let's look a bit on the history of tuberculosis. So tuberculosis is formerly known as consumption, has been recognized for thousands of years as a devastating disease. And throughout history, tuberculosis has caused significant health crises, affecting populations worldwide. In the last century, we have seen major advancements in understanding and treating tuberculosis, leading to a better health outcomes. When we look at the global impact and significance of tuberculosis is one of the top infectious disease killers worldwide, affecting millions each year. The WHO, or World Health Organization, emphasizes the importance of TB control measures in high-burden countries. And increased awareness and resources are vital for effective tuberculosis prevention and treatment globally. Let's look at some Malaysian statistics. So recent statistics indicate that Malaysia faces a significant burden of tuberculosis, affecting public health. Continuous monitoring of tuberculosis cases is essential for effective outbreak management and control strategies. Accurate reporting of tuberculosis data helps in formulating strategies to control and manage the disease effectively. So let's look at some of the studies. So this one is from Blue Gallant Center. According to reports from the Ministry of Health Malaysia, the total number of reported TB cases in 2023 amounted to 26,781, marking a 5.5% increase compared to the 25,391 cases reported in 2022. So there's an increase. And this is another study from PM Care. So the Ministry of Health is striving to achieve a TB-free status for the country by 2035, as outlined in the End TB strategy envisioned by WHO. Let's talk about the high-risk populations. So who are at risk of getting TB? So individuals with weakened immune systems are at higher risk of tuberculosis and require special attendance and care. People who live in crowded or overcrowded conditions are more susceptible to the spread of TB, necessitating effective interventions. And also, migrant workers often face increased risk of TB due to a living arrangement and limited access to healthcare. So, comparison with global rates. Malaysia's current tuberculosis rates show some improvement compared to previous years, yet challenges persist. Global comparison. Comparing Malaysia's tuberculosis figures with global rates reveals areas needed greater focus and intervention. And despite progress, Malaysia must enhance efforts to reduce tuberculosis incidences and improve health outcomes for patients. Let's learn more about the causes and transmission of tuberculosis. So, the Mycobacterium tuberculosis bacteria is the slow-growing bacterium responsible for tuberculosis, affecting millions worldwide. This bacterium has a slow growth rate, allowing it to persist in the human body for extended periods. And the resistance of Mycobacterium tuberculosis is certain treatments complicates effective management of tuberculosis infections. How are they transmitted? Firstly, by airborne. So tuberculosis is primarily spread through airborne droplets released when an infected person coughs or sneezes. Understanding how tuberculosis spreads is crucial for developing effective control measures to prevent transmissions of TB. How about the risk factors and vulnerability? As mentioned previously, individuals with weakened immune systems are at high risk of tuberculosis infections, making it essential to address their health needs. People who are malnourished or malnutrition is significantly increases the risk of developing tuberculosis by compromising the body's ability to fight infections. And people who are staying in overcrowded areas, dense living conditions, heightens the risk of tuberculosis transmission, emphasizing the needs for better housing and community health measures. Let's learn about the stages of tuberculosis or TB. So exposure and infection. So the first stage is the initial exposure to the bacteria, Mycobacterium tuberculosis. May not always result in active tuberculosis disease, highlighting the need for awareness. Understanding stages. Understanding the stages of tuberculosis infection is essential for effective early intervention and implementing surveillance measures. And early intervention with timely diagnosis can significantly reduce the risk of developing active tuberculosis disease. So with latent TB infection, as in inactive bacteria remains inactive within the body, posing no immediate health threats. Individuals with latent TB do not exhibit any symptoms, making it difficult to detect without testing. And the risk of active TB, while latent TB cannot be spread, individuals who are at risk of developing active TB, individuals are at risk of developing active TB if not treated. And from latent become active. Active TB occurs when dormant bacteria becomes active, resulting in noticeable symptoms that affect health. So during the active stage, TB is contagious, making it essential to identify and treat affected individuals swiftly. Immediate treatment is crucial to prevent further spread and to help the infected individual recover effectively. Let's learn about the signs and symptoms of tuberculosis. When we talk about TB, the symptoms of TB, we were primarily talking about pulmonary TB symptoms or symptoms associated with the lung. So firstly is the persistent coughs. One of the primary symptoms of pulmonary TB is a persistent cough that lasts for weeks, indicating lung involvement. Then we have chest pain. Chest pain can occur due to inflammation, infection of the lung, or just because of persistent coughs that can cause inflammation, signaling the presence of tuberculosis. And in serious symptoms, serious cases, there may be coughing of the blood, and requires immediate medical attention for diagnosis. And then we have extra pulmonary TB symptoms, or symptoms outside the lung. So commonly affects areas such as lymph nodes, bones, and other tissues, which complicate the diagnosis. Symptoms may vary significantly depending on the location, making it challenging to diagnose extrapulmonary TB. As mentioned previously, the common signs and symptoms are like fever, weight loss, night sweats, are often the first indicators of underlying health issues, but there are also uncommon signs which may vary greatly depending on the individual and specific conditions, making awareness crucial for diagnosis. So awareness of both common and uncommon symptoms can significantly aid healthcare professionals in diagnosing conditions accurately. So what about the general treatment approach? So the initial step in diagnosing the tuberculosis involves a thorough clinical evaluation of symptoms and patient history. Some of the diagnosis they will do is, for example, tuberculin skin test, which is a common diagnostic tool used to identify potential tuberculosis infections. Another more common diagnosis tool is the chest X-rays, which is crucial for visualizing lung abnormalities associated with tuberculosis, aiding in diagnosis. So they'll see any findings, abnormal findings in the lung that suggests potential for tuberculosis. And importance of prompt diagnosis. Timely diagnosis of tuberculosis is vital for implementing effective treatment strategies and preventing disease spread. So the first line treatment options include antibiotics, which is essential for combating the disease effectively. And the treatment course for tuberculosis typically lasts from 6 to 9 months, requiring consistent patient commitment. And adherence to the prescribed antibiotic regimen is crucial for achieving successful treatment outcomes and preventing resistance. And let's say you don't follow the plan or the routine for the medicine, the disease can develop drug resistance, which is a significant challenge in tuberculosis treatment, complicating standard therapies and requiring alternative strategies. Patients' adherence to treatment regimens is crucial for successful tuberculosis management and require effective support systems. And the access to healthcare systems or services remains a critical barrier to effective tuberculosis treatment, especially in underserved communities. In conclusion, tuberculosis is a major public health issue affecting millions worldwide, necessitating ongoing awareness and action. A thorough understanding of tuberculosis history, prevalence, and cause is essential for effective management, and exploring treatment options and strategies is vital for combating tuberculosis and reducing its impact. Thank you.